All right, diving in. Today, it's all about nursing. We're going deep on what makes this profession tick. Everything from the history to the stuff nurses face today. And get this, our source. It's a study guide. Foundations of Nursing Practice. Wild, right?
Yeah, study guide deep dive.
You'd think it'd be dry, but
More interesting than you'd think.
yeah.
Right away, it kind of throws that whole nursing is just bedside care thing out the window.
True, someone like me, not in healthcare, I probably picture nurses in hospitals mostly.
That's just a tiny piece.
Hmm.
This guide, it digs into how many different nursing roles there are. Specialists, teachers, people doing research, even way up in administration. It's huge.
So not just the stereotype, taking temperatures, fluffing pillows, that whole bit.
Nope. Think more like a nurse practitioner running their own clinic, or a nurse anesthetist handling those super complex procedures. And the guide makes a point of how much nursing is changing. Healthcare reform, tech, all that, even how the population's changing. It all impacts what nurses do.
Yeah, that makes sense. Healthcare's always in the news. It's got to be moving fast. But I'm curious about the roots. Where'd this all begin?
Well, we go back to Florence Nightingale, but not the usual stuff. It's not just about, the lady with the lamp thing. This guide highlights how she was keeping super detailed records during the Crimean War. And that data, it proved that better hygiene, it drastically cut down on soldier deaths.
So she wasn't just caring for the wounded. She was practically inventing data-driven healthcare.
Exactly. And the stuff she did, it led to hospital reforms that still matter today. That's what's cool about this guide. It's packed with those aha moments. Changes how you see nursing.
Okay, I get why we're diving into this, but how did nursing go from, taking care of soldiers to all the roles we see now?
The 20th century, that was big. Nursing got more, scientific, more research-based. And medicine was advancing, so nursing, it specialized right along with it. Suddenly you needed nurses who were experts. Pediatrics, cardiology, oncology, you name it.
Makes sense. Every field, it's all about specializing these days. But we've got all these nurses in different areas. How do they go from newbie to, seasoned pro?
The guide talks about Benner's model, outlines these stages of how good a nurse gets. Starts at novice, goes up to expert. Each stage, it's about specific skills, knowledge, all that.
So, a roadmap for a nursing career.
Yeah, exactly. But, gotta admit, this part of the guide, it gets a little dense. Really breaks down each stage, which if you just want a general idea, might be too much.
Yeah, I can see that level of detail being more for, someone actually studying nursing.
Right. Big takeaway, though, being an expert nurse, it's not just about how long you've been doing it. It's about actively getting better, taking on tougher challenges, and honestly, a lot of thinking about your own work, reflecting on it.
Applies to anything, really. Always got to be pushing to learn, to grow. This study guide also goes into the more official side of nursing, right? The rules, the guidelines, all that.
Oh, absolutely. It talks about professional organizations
Mm-hmm.
like the American Nurses Association, the ANA, and the standards they set.
So kind of the official playbook on how to be a nurse.
Exactly. But here's where it gets interesting. The ANA standards of nursing practice, they're all built around this thing called the nursing process. Basically 6 steps to make clinical decisions.
6 steps, that's thorough.
It is. Make sure nurses are thinking critically, systematically about patient care. But honestly, don't think we need to deep dive into all 6 right now. Main thing is, it's a structured, evidence-based way of doing nursing.
Okay, so it's a mental checklist, making sure everything's covered. Makes sense. But nursing, it's not all checklists, right? There's got to be a huge ethical part, too.
You're right. The ANA, they have separate standards for professional performance. Emphasize ethical conduct, communication, leadership, all that. And the guide gets into the nursing code of ethics. Helps nurses when they're in those really tough spots.
Like what kind of spots?
Imagine, a patient's family doesn't want them told about their diagnosis, but the patient has the right to know, that kind of thing. Nurses face those dilemmas, and that code, it guides them.
So it's not always clear-cut. Got to balance the rules with what's best for the patient.
Exactly. And it's not just personal ethics. Every state has its own Nurse Practice Act.
Yeah.
Spells out legally what nurses can and can't do. Whole legal framework to keep patients safe and guide how nursing works.
Okay, so you've got the ethical stuff, the legal rules. But nursing, it's not a solo act, right? You can't just go off and do your own thing.
Definitely not. The guide is clear, teamwork is key. It specifically mentions the nurse coordinator role, especially in hospitals.
A coordinator, so making sure everyone's on the same page.
It's even more than that. They're responsible for the patient moving smoothly between departments. or even different facilities. They're advocating for the patient's well-being, making sure nothing gets missed. Huge responsibility, especially with how complex healthcare is.
I bet. Especially with the nursing shortage everyone's talking about, I can see that role being so important.
Absolutely. But beyond just coordinating, the guide talks about this really interesting concept called just culture.
Just culture. That's new to me. What's that about?
So imagine a nurse makes a genuine mistake. In the old way of thinking, they might get punished. Just culture, it flips that. It's about learning from errors, not punishing them.
That's a big difference because honestly, everyone makes mistakes, especially in a high-pressure job like nursing.
Exactly.
Yeah.
But it's about what happens next.
Yeah.
Just culture, it encourages being open about mistakes. So everyone learns and prevents them from happening again.
Makes so much sense, putting patient safety above, blaming people.
Exactly. But the guide also gets into this, well, darker side of nursing, the whole incivility issue.
Incivility, you mean like bullying?
Yeah, exactly. Whether it's from other nurses, doctors, even patients, that kind of behavior makes the workplace toxic. The guide highlights how important open communication and respect are to tackle this.
That's kind of unsettling. Nurses dealing with that on top of everything else really shows how important teamwork is. And it can't just be nurses working together, right?
Yeah.
It's everyone.
Oh, definitely. Guide emphasizes interdisciplinary teamwork. Nurses work with doctors, therapists, social workers, everyone involved with a patient, and communicating clearly. That's vital. Guide even mentions techniques like SBAR, stands for Situation, Background, Assessment, Recommendation. Make sure everyone's on the same page.
I've actually heard of SBA. It's like a way to be super clear, especially when things are urgent.
Exactly. Gets rid of the extra stuff, gets right to the point. Super important in healthcare. But with all this talk about teamwork, communication, we can't forget about the actual skills nurses need, right? Like at the bedside. Of course not. Guide really stresses those core clinical skills, like making decisions in the moment based on what you're seeing with the patient.
So not just following the textbook, but like really thinking critically right there.
Exactly. Plus, it stresses organization, managing time well, especially when you've got multiple patients.
Sounds like nurses need superpowers to do this job.
Well, they definitely need a lot of different skills. And the guide is clear. The learning doesn't stop after nursing school. It encourages nurses to stay up to date. New research, best practices, all that. Continuing education is huge.
Makes sense. Healthcare is always changing. There's always something new to learn.
Exactly. But with all the focus on skills and knowledge, we got to remember the most important thing, the patient.
Right. At the end of the day, it's about taking care of people.
And the guide emphasizes this thing called patient-centered care. Patients' needs, their preferences, those come first. It's about seeing the whole person, not just their symptoms.
Sounds like a big shift from how healthcare used to be, back when doctors were like the ultimate authority.
It is a shift. And the guide talks about how important it is to give patients the power to make decisions about their own health. Informed decisions.
So it's more collaborative. Patients are actively involved.
Exactly. And that means things like respecting their autonomy, making sure they truly understand what they're consenting to.
So patients have a voice, a choice in their treatment.
Absolutely. The guide even mentions those advocacy groups working to improve healthcare policy, make sure patients' rights are protected.
We've covered so much, and it's clear nursing is way more complex than I ever realized.
It really is, and we've only scratched the surface. But before we go deeper, let's take a little break, give our listeners a chance to, process all this.
Okay, back to the deep dive. We are in the thick of it with nursing, and I'm honestly starting to get a feel for this whole profession.
Good. Yeah, it's one of those things. The more you look, the more complex it gets.
Totally. Speaking of complex, I'm thinking about how healthcare actually works.
Mhm.
Like how it's all delivered. It seems like it's constantly changing, so many different people involved.
You're right on there. And this study guide, it gets into how different healthcare agencies impact what nurses do.
Okay, so we're talking about like the CDC, the NIH, all those acronyms you always see.
Exactly those. And they're not just like these big machines. They have real effects on the ground. They shape the rules, they do the research, set guidelines. It all ends up influencing nurses' day-to-day work.
I can see why nurses would need to keep up with what those agencies are doing. It's all connected.
It is. It is. It's about making sure patients are getting care that lines up with the latest recommendations, the scientific stuff, all that. And speaking of keeping up, the guide also talks about some big trends that are shaping healthcare right now.
Ooh, trends. Always love a good trend report. What's hot in healthcare these days?
Well, one that's really shaking things up is this focus on Get ready for it. Patient and family-centered care.
Okay, that's a mouthful. What's that actually mean for nurses?
It's a shift. Used to be the doctor was in charge, making all the calls. Now it's more about patients and their families being involved in those decisions, what they prefer, their values, all their individual needs.
Yeah.
That's at the center of how you plan their care.
That's a big change. I bet it takes some serious communication skills for nurses to handle that.
You nailed it. Nurses are becoming more like facilitators, helping patients figure out all this complicated healthcare stuff, speaking up for their choices.
It's like nurses are healthcare translators, bridging the gap between like the medical world and what the patient is going through.
Perfect way to put it. And this trend, it ties into another one the guide talks about, evidence-based practice.
So that's about like making sure the treatments are backed up by science, right? Not just like doing things the old way because that's how it's always been done.
You got it. And that means nurses have to really understand research. They're always looking at new findings and figuring out how to use them in their work.
It's like they're constantly learning, which honestly sounds kind of tiring.
It can be demanding, for sure.
Yeah.
But it also keeps things interesting, intellectually.
Mm.
And then, of course, there's the big one, technology.
Oh yeah, tech is changing everything. No way healthcare is escaping that.
Not a chance. The guide mentions all the advancements, electronic health records, telehealth, keeping track of patients remotely. It's all changing how care is delivered.
I can see how that'd be both exciting and like a little scary for nurses. Exciting because of what's possible, but scary because of how fast it's all moving.
Exactly. And that's where nursing education comes in, big time.
So nurses are back to hitting the books, learning all this new tech stuff.
You got it. Continuing education, it's practically a requirement these days. Advanced degrees, workshops, online courses, you name it. Nurses are doing it all to stay ahead of the curve.
Good thing nurses seem to love learning. But I'm wondering, with all these different ways to learn different roles, what kind of work environments are nurses looking for these days?
That's where this thing called the Magnet Recognition Program comes in.
Magnet recognition. Never heard of it.
Think of it as like the gold standard for hospitals. Show they've got excellent nursing practices.
So like the Michelin star of hospitals.
Huh. Love that.
Yeah.
But seriously, it's not just about having fancy stuff. These hospitals, they build a culture that values nurses. They help nurses grow professionally, give them a say in decisions.
Feels like everybody wins. Happier nurses, better care for the patients.
You got it. And there's research to back it up. Magnet hospitals, they keep their nurses longer, their patients do better, and the overall quality of care is just higher.
Okay, work in a magnet hospital, going on my imaginary nursing career goals list. But beyond the setting itself, the guide talks about different leadership styles in nursing too.
Oh, yeah. Having good leadership, it's key to creating that positive environment we were just talking about. The guide mentions a few different styles, like transformational leadership, transactional leadership, and servant leadership.
That's a lot of leadership terms. Can you break those down for me?
Sure. Imagine you're a nurse working on a busy unit. A transformational leader, they'd be inspiring, motivating the whole team to go that extra mile. They'd encourage creativity, make everyone feel like they're working toward the same goal.
Sounds like the kind of leader you need to get everyone going, even on a tough shift.
You got it. Now, a transactional leader, they'd be more about clear tasks, clear expectations. You do this, you get that kind of approach.
Okay, so more about efficiency, getting things done. What about servant leadership? That one sounds kind of different.
A servant leader, their priority is the needs of their team. They're all about supporting nurses, helping them build their skills, giving them the power to do their jobs well.
Leading by example, basically.
Yep.
By serving others first.
Exactly. And each style, it has its place in nursing. The guide even suggests that good leaders, they can switch up their style depending on what's going on.
Like having different tools in your leadership toolkit. But no matter what style, communication seems like it's always important.
You said it. The guide really emphasizes how crucial it is to have clear professional communication within the healthcare team. Nurses, doctors, therapists, everyone needs to be on the same page to keep patients safe and make sure the care is coordinated.
We talked about SBR, but are there other communication strategies nurses use?
Oh, tons. Active listening is huge. Really hearing what your colleagues and patients are saying. And of course, documenting everything clearly, especially with electronic health records.
Yeah, if people aren't writing things down right, things could get messed up fast.
Exactly. And some teams, they have these regular huddles or meetings to make sure everyone's in the loop and to deal with problems before they get out of hand. But communication, it's not just about preventing problems. It's also about building relationships.
That human connection thing again. Seems like a big theme in nursing.
It really is. And it's something this guide emphasizes in subtle ways all the way through. But we can't forget that behind all the soft skills, nurses need to have solid knowledge. They got to build that knowledge and keep it up to date.
Right, you can be a great communicator, but if you don't know what you're doing, it's not going to matter much.
Totally agree. The guide encourages nurses to actively build their knowledge. Keep up with research, go to conferences, find mentors. It's all about continuous learning.
Pretty impressive, honestly. Seems like nurses have this, constant curiosity. They're always pushing to be the best in their field.
It is admirable.
Yeah.
Shows how committed they are to giving their patients the best possible care.
And speaking of patients, we can't talk about nursing without talking about ethics.
Oh, for sure. Ethics are at the very heart of the profession. The guide brings up patient-centered care again, emphasizes how important it is to respect patient autonomy, make sure they're giving informed consent.
Sensing a theme here. Patient-centered care. It's like the guiding principle for everything nurses do.
You got it. And that means respecting boundaries, keeping things confidential, holding yourself to the highest ethical standards.
Starting to get why people say nursing is more than a job. It's like there's this moral compass guiding everything they do.
Exactly. And we can't forget about the impact of laws on healthcare.
Right? Laws and regulations, they have a huge influence on how everything works.
Huge. Things like who can get care, how things get paid for, even what nurses are allowed to do. It's all affected by legislation.
So nurses need to be legal experts too.
Maybe not experts, but they definitely need to understand how healthcare laws affect their work and their patients.
This deep dive is really giving us a complete picture of nursing. A lot to take in, but it's fascinating to see how all the pieces fit together.
It is, and there's still more to cover. But before we get to the final part of our deep dive, let's pause here for a moment, give our listeners a chance to think about everything we've discussed so far.
All right, final stretch of our nursing deep dive. You know, I gotta say, this study guide has really thrown me for a loop. Way more engaging than I thought. I feel like I'm actually getting a sense of how, deep and complex this whole profession is.
It's something else, isn't it? We've gone through the history, the tough parts, the systems, all that. But now I'm thinking about the human side of it. What makes a nurse, truly great?
Yeah, we've got all the pieces, but how do they actually come together in, real life?
Exactly. And this guide, it doesn't have a list of exceptional nurse qualities or anything, but it kind of hints at them throughout, like critical thinking, being able to make clinical decisions in the moment. That's got to be up there, right?
For sure. We talked about how nurses have to, analyze stuff, figure out the risks, make judgment calls on the fly. That's a lot of pressure.
And they do it all while staying cool. I think that's a big part of what makes a great nurse, being resilient. They deal with crazy situations, families who are stressed, long hours. They got to be tough, but also
compassionate. That's what I was just thinking. It's not just being nice. It's about really connecting with patients. A lot of them are going through really hard stuff.
You're right. It's about getting their fears, their anxieties.
Yeah.
Giving them comfort, even when, there's no easy answer. And that brings us back to communication.
Yeah.
So important in so many ways.
We talked about it with teamwork, but it's just as big when you're actually interacting with the patient.
Absolutely. The best nurses, they can explain all that medical stuff in a way anyone can understand. They listen, really listen. They give clear advice, but they're empathetic. They're that link between the patient and the whole healthcare system, which can be super overwhelming.
They're advocates, not just caregivers. Speaking of which, advocacy, that's another thing that stands out.
Definitely. We've touched on it, but great nurses, they really fight for their patients. They speak up, make sure their needs are met, navigate the system to get the best outcome.
And sometimes that means pushing back against doctors or even the way things are usually done. It takes a courage to do that.
It does. And it takes a deep understanding of ethics. Knowing what's right, putting the patient's well-being first, no matter what.
Man, it's clear nursing is not just a job. It's skills, knowledge, and heart all mixed together.
Couldn't have put it better myself.
Oh!
As we're wrapping up here, I'm thinking, what's next for nursing?
That's the big question, right? With all the technology changing things, how patients' needs are evolving, all the challenges healthcare is facing, what do you think the future holds for nursing?
You know what? I think that's a question for our listeners to think about. We've given them the basics. Now it's their turn to explore.
I like that. That's what this show is all about. Getting people curious, giving them some insights, and then leaving them with something to chew on. We've only scratched the surface today, but hopefully we've shed a little light on the world of nursing.
I think so. It's a profession that deserves a ton of respect and a lot of gratitude.
Couldn't agree more. To all the nurses out there, thank you for everything you do. And to our listeners, thanks for joining us on this deep dive. We'll catch you next time.